Hello, it's Kevin here. Time for a video for OET right now. First things first, get my disclaimer on. Fair use, etc, etc. Okay. Got the criteria here. Give me a pencil, all ready to go. Now, I've got a few letters. I'm going to try and do, 3 or 4 videos over the course of the day. It's Monday morning, and pretty busy as always. I did an OET video about 4 days ago. I hope that helped. If you're in my Telegram group, OET Right Now, I posted it there. If you're watching on YouTube, you may have seen it. Maybe not. But anyway, last one was 4 days ago, and I've got a few more. So I'll put the link for the group below. If you want to join, you can do. You can post your letters also. Be warned though, I may well use them for content like this one here. It will be anonymous though, but be aware. Anyway, so let's get on with this one. I've got 15 minutes before my next lesson, and it's going to be like this all day. I've got 10 or 15 minutes in between lessons, etc. So I'm going to try and knock out a load of videos. It's not ideal, but that's how it goes. Anyway, gynaecology registrar, Miss Cathy Jones, to request urgent assessment for Miss Jones. Clinical features are consistent with ectopic pregnancy. Okay, that's pretty clear, yeah. Now, if you've got the DOB in the notes, I will put it there. You should have it. I mean, if it's like if it's proper material, you should have it. So you put the DOB there. Urgent assessment. Purpose. Now, that's pretty apparent as far as I can see. Just a quick word. For most of you, 350 plus B is 25555. So that's more or less 350, right? So you can get some good marks right off the start. Get that purpose. Dear Dr. So-and-so, dear whoever, I want you to do XYZ. That's the purpose part. Now, you usually expand it. Maybe at the end, I would appreciate if you could do this, this. But first things first, like it says here, quick, precise, boom. No time wasting, right? Immediately identifiable. No need to search. What do you want me to do? What do you want? I don't know. Well, that's what you've got to do, yeah? Boom. Dear doc, can you do this? Now, what you've got to do now is to tell me, the reader, why you want me to do what you want me to do. Okay? So, let's take a look. Miss Jones presented. Now, you don't have to say to the surgery because it's obvious, she presented. Where else would she present? To a supermarket car park? So, you don't need it. Complaining of lower abdominal pain since the evening before, which was worse in the right iliac fossa. Don't forget, it's supposed to be grammatically complete sentences. Now, no bladder or bowel symptoms. Okay, so you could join these sentences because there's a contrast now, right? However, there were no. So you could join these sentences if you wanted. However, there were no bladder or bowel symptoms. So you've got the patient came, I've got this, however, they didn't have that. Okay? So she was unsure of her last menstrual period and had irregular bleeding, past perfect since starting what? So she was as I keep saying, right, if the reader's got to scratch their head, if it's not making sense, if they've got to stop and think, that's not as clear as it could be. All right. So Miss Jones presented complaining of pain which was worse in the right fossa, no bladder or bowel symptoms. Okay. Unsure of the last period, so she doesn't know when she had her last one. So is she having one now? Irregular bleeding since starting? Since starting what? So, on examination, now, what we can do is get rid of all this she pronoun, she. On examination, mild fossa tenderness or guarding was found. So you could do that, because they like you to use your passive voice. Then with number bounding or guarding, was detected, was found, was noticed. And appraxial pulsated. Cathy Jones. Well, why would you put the full name? Kevin Anthony Dean. They usually only use my full name when I've done something wrong, So just put Miss Jones. Okay, so you've got a full name at the start. You don't need it, just Miss Jones, she, etc. Miss Jones would like to return next morning for blood test and reassessment. On subsequent visits, you mean next day. Further deterioration of symptoms. She had severe constant pain. And, right. Now, this is something that I see a lot of people doing very short sentences. So, essentially, they take a case note and make it into a sentence, but it's not connected to the other sentences. And that's not really what you're supposed to be doing. You're meant to be telling a story, as it says here, right? Let me get the criteria. How well do you summarize the information? How well do you do that? So if you've got case note sentence, case note sentence, case note sentence, case note sentence, that's a mechanical listing of everything, every kind of note. So what you need is to join, group-like information. Join your sentences. Okay? So, was marked with tender, and was marked with tender fights. Pregnancy test showed positive. You don't have to say she took a test for pregnancy and this test for pregnancy showed. That's not very concise. Make it more concise or conciser. Pregnancy test showed positive result. Or she tested positive for pregnancy. Okay. Miss Wright, again, you don't need to give a full name. Miss Jones, next to previous phrases. Mass medical history is unremarkable. Is. Now, if I come to right, so you've got short sentence, short sentence, short sentence, short sentence. Case note, case note, case note, case note. You're not going to get particularly far if you do it like this. All right. Join your sentences up, conjunctions, and use commas, relative pronouns, that, which, who, whom, whose. That sounds better. Apprentice. So, right. So you've got no history, then you've got her past. Well, all history is past. So we don't even need this, really, do we? So you said she's no history of pregnancies. When you say her past, well, of course it's past because it's history. Unremarkable. So instead of telling me what there isn't, tell me what there is. That would be more concise and to the point, yeah? Progesterone for contraception, and there's a family history of deep vein thrombosis. Appreciate your attention to this patient. You are sincerely, doctor. Okay, so not too bad. For this one here, though, like I say, I will try and avoid case note sentence, short stop, case note sentence, short stop. You need to be a little clearer in summarizing, right? So there's no irrelevant information really, right? So that's not bad. So the purpose is clear, okay? Can you see this patient, blah, blah, blah. then you're constructing a narrative, you're telling the story. Yeah. So what you're going to think about then, the context good, conciseness, as I say, it's how you summarize it and present it. If it's she, sentence, pronoun, sentence, she, and stop, she, and she, that's not really summarized effectively, is it? Really, if you're doing that, you know? So that's what we need to be thinking about, yeah? How well it's summarized. So no time is wasted. So if I've got to read 4 separate sentences, she, stop, she, that's taking more time than if you have a single sentence, she, symptom, stop. Isn't that going to be quicker? Anyway, not so bad. I'll have to leave it now because I've got to get back to my students. So I'm going to do some more. I'll probably upload these in sequence, probably all at once this evening because I haven't got time. But anyway, there's some more to come, so keep your eyes open.